My close friend Sally, who lives in Townsend, Vermont, was visiting friends in Burlington for Thanksgiving. As an older adult, she has some medical concerns, but she's always been too proud to discuss her problems, even with close friends. She arrived in time for Thanksgiving festivities, but before we even got to the appetizer course, Sally fainted while walking down a flight of stairs. Her friends rushed to her side. She tried to speak, but was disoriented and mumbling. One of her friends called 911.
911, what is your emergency?
My friend fainted and fell down a flight of stairs. I think we need an ambulance.
What is your location address?
4785 Sprucewood Road in South Burlington.
Is your friend conscious?
Well, she's awake, but she's not making any sense.
Okay, I'm sending the ambulance now. I'll stay on the line with you.
Oh, please hurry.
Okay, they're on the way. Tell me, does your friend have any medical conditions that they should be aware of?
Well, I think she has a heart problem, but I don't know what it is.
Do you know if she's on any medications?
No, I really don't know.
You're going to room 2?
Here's the paperwork. This is Sally. She's 72 years old. Fell down the stairs about 30 minutes ago, got lightheaded. She fell down about seven stairs, excuse me. Vital signs, blood pressure 135/89. Heart rate slightly irregular, tachycardic at 120. Respiratory is 26. O2 is 94 at 2 liters of O2. Checked her blood glucose on the ride. She was low at 32. Gave her a D50 bolus, started her on a D5 drip. Last check, her glucose was 60. She's got a 20 gauge IV in her left arm. She's oriented to person, but can't report where she is or that it's Thanksgiving. She has a contusion on her forehead, bruising on her right hip where she reports pain on palpation, and is unable to lift her legs. Her friends can't give a medical history. They think she's on meds, but her luggage is at her hotel room.
Are you family?
No, just a friend. But I've been trying to contact her family.
I'm going to have you go back to registration to get as much information as possible.
But I really don't know anything about her medical condition. Just that she has a bad heart.
It's okay. Just give as much information as you can to registration. As soon as she's settled, I'll come back and find you. Should be just a few minutes.
What is your friend's full name and address?
Sally Wagner.
And date of birth?
Oh, October 2nd, 1941.
Has she ever been to this hospital before?
Oh, I don't think so. No, she's not from around here.
Do you have her address and phone number?
Yes. 23 Maple Street, Townsend, Vermont. 802-555-2345.
Do you know where her primary care doctor is?
No, sorry.
What about health insurance information?
No, she left her purse in her hotel room. I don't have any of that either.
Okay, well, maybe we can pull up some of this information from Vital Access. Why don't you have a seat? That'll fill in some of the holes. And the nurse will come back and tell you when she's ready for you.
Her vital signs are stable right now, but she's still disoriented. We're getting an ECG now. The tech is drawing labs. All her friend can tell us is she has a bad heart.
Her friend doesn't know any of her medical history and none of her providers.
I think you should look into Vital Access. See if her data's in there.
Okay, I'll log in. Have you seen how this Vital Access works?
No, I haven't.
Do you have a minute? I think we can find out some significant information.
Well, yes, I have all the time in the world. Actually, she's stable and Mary's with her, so I have a minute.
Okay. Okay, now I can search for, what's her name again?
Sally Wagner, DOB 10/2/1941.
Ah, there she is. Hopefully she has signed consent so I can see her information. This isn't what I'd call life-threatening emergency, so if she hasn't given consent, I can't view her, access her data. Okay, here it is. She has signed consent, and so I now have access to her problem list. She has chronic AFib and type 2 diabetes. No wonder her sugar was low. Her last HbA1c was 9.3, so it doesn't look like she's very well controlled. She was last seen at Grace Cottage for a fall about 2 months ago, and they were concerned about worsening osteoporosis and had recommended a follow-up bone scan. Right. Here is her recent med list. She is taking oral meds for glycemic control and Xarelto for chronic AFib. Oh, we should make sure to put a PT/PTINR on her labs. Okay, I'll generate a summary document through VITL Access. This will give us an overall medical picture of her history and recent lab work and also radiology reports. Okay, I'll download this and print it.
Unfortunately, Sally had broken her hip and needed to be admitted for surgery. The emergency room was able to use VITL Access to view her records from Grace Cottage Hospital and have a comprehensive medical picture. Following her surgery and some minor complications, she then went to a rehabilitation facility, still in the Burlington area.
Hey, Jamian, the hospital sent the patient information on your transfer.
Was she here already? I didn't get the page.
No, not yet. They called and said they were on their way. They'll be here in about 5 minutes.
Perfect timing. They're almost finished turning over that room. Can you make sure that we can read the lab results? Some of those fax results that come over are blurry. And management wants to make sure that we have actual documentation, not just verbal results.
No worries. That information is all coming through electronically now.
Boy, you're on vacation for 2 weeks and everything's changed.
They're emailing a summary report when they transfer patients to us. It includes their hospital course and a med reconciliation prior to discharge.
So no more copies of copies? Oh, wait, email? I didn't think we could do that.
Well, it's not regular email. It's something called VITL Direct. Here, I can show you how it works.
Interesting.
And I had to go through a process to access our office mailbox. They wanted 2 forms of ID. Felt like I was applying for a job. Anyway, it's supposed to be super secure and allows us to email patient information.
Interesting. What's in the summary?
This allows, now already saved me a lot of time compiling records.
There's a first.
You're so cynical. This allows for a slew of information. I've spent a lot less time on the phone tracking down labs and care plans. I've even found one, or several, that contain their immunization and, and this one, I was able to find out who her PCP and cardiologist are.
Wow, sounds promising.
Well, the best thing is, I don't get a mountain of paperwork that I don't need.
Oh, good afternoon, Sally. We've been expecting you. Let's get you settled in. Who did you bring with you?
I'd like to say it's nice to meet you, but I'd rather not be here. This is my daughter, Annette.
I won't take that personally. It's nice to meet you both. Now, I've been looking over your charts, and it looks as though you've had a rough few days. There were complications following your surgery and trouble controlling your blood sugar.
It was awful. I never expected that Thanksgiving dinner would turn into 6 days in the hospital and then rehab. The doctor in the ER told me that they were able to see my records from my regular doctor. I'm not from the area, you know.
Yes, well, it's very helpful to have a whole picture of a patient, especially in an emergency. Speaking of, the hospital sent over the reports from their discharge, and I got a report from the nurse who was taking care of you.
Oh, thank goodness, because I can't remember what medications I'm on. The doctors over there gave me to me so many changes, and now I'm seeing all sorts of new doctors, and I can't keep track of things. And my daughter's worried that information is going to get lost in the shuffle.
Well, it's very helpful that your daughter is here to help. This can all be very confusing. If it's okay with Sally, we can keep you in the loop about everything that's happening while she's here.
Oh, absolutely. You can tell her anything you want to.
Well, I'm trying to figure out how I'm going to get all of this information back to her regular doctors. Are you sure she shouldn't be someplace closer to home?
Well, that's entirely up to Sally. But honestly, it doesn't really matter where your reports are. We're going to send them everything from your stay here, and if we need something from them, they can either email us, or we can look it up the way the ER did using VITL Access.
Hello, Sally. I'm Peter. I'll be the nurse practitioner checking on you throughout your stay.
Well, what about the doctor who sent me here?
Oh, never fear. I'll be in close contact with her throughout your stay. Should we need to make any changes, Sally, I can email her.
Oh, good grief. Doesn't anybody pick up the phone anymore?
Sometimes I wonder that myself, Sally. Truth be told, I was a skeptic at first, but have come around. You have no idea how hard it can be to get a doctor on the phone. This way, I can send him a secure email when it's convenient for me.
Well, that's so good. I'm glad. That's so...
Sally spent 2 weeks in rehabilitation and was very much looking forward to going home.
All right, Sally, are you ready to go home?
Finally. It seems like it's been ages.
We have made appointments for you to see your primary care doctor, as well as a new orthopedist closer to your home.
Can you write down all the medications I'm on? I'm sure my doctor wants to know that my diabetes medicine has been changed during the last few weeks.
We'll certainly review all of your medication as well as get you a copy. It's also now standard for us to send a message, kind of like an email to your doctor. This will summarize all the care you received while you were here, your lab results, and also changes to your medication. We'll send this information to your new orthopedist, and both of them can see this information on VITL Access.
Well, I'm not sure I want all my mother's medical information being sent to someone in an email. That sounds risky to me.
I understand. Maybe email is not the best way to put it. The email system is known as VITL Direct, and I can assure you it's incredibly secure. The email the only people who have access to the email are people in the healthcare setting, people who have already been granted access to see your medical information.
Well,
All right, that sounds good to me. Thank you.
All right.
are we going? Oh, my goodness.
Yes, we're going to go now, Mom.
Sally finally got to go back home to Townsend, and she needed close follow-up with her primary care physician because changes had been made to her routine medication. She will be seeing a new orthopedist as well as a follow-up to her hip surgery.
So, this is your first week. Let me show you how to prepare for tomorrow's schedule.
Well, this is going to be different. I'm used to pulling charts. How do you prepare for electronic charts?
Well, first of all, we're going to look at our first patient of the day. Sally's the new patient. Let's see now. Okay, she's new, so her visit is considered a transition of care. See right here?
Okay, yeah.
Okay. Now, our care coordinator received word that she'd just recently been discharged from a rehab facility up near Burlington. So they told us to be on lookout for her.
Okay.
Okay. Now, we need to make sure that her summary of care documents have been received. So we can preload her problem list, right here, her medication list, and her demographics. Now, Dr. Smith likes to have as much information as possible from the emergency room. So we'll need to make sure that her labs, let's see, her radiology, and her care plans are available, right here.
Right.
Okay. Now, if she were seeing Dr. Anderson tomorrow, we would only need to make sure that the summary of care was here.
So we need to have the labs and probably the radiology faxed, correct?
Oh, no, we don't have to have them faxed. We can find them right here in VITL Access.
Oh, all right.
Okay.
Well, that's right. Vital Access. I haven't received my training yet. That's like next week.
Just watch me right now. Okay, first we'll need to confirm that she's given her consent.
Okay.
And then if she hasn't, I'll just walk you through that process.
Consent for what?
Oh, if she gives her consent, then we have the right to look at her information from other healthcare facilities. Okay, now she only needs to do it once. So if she did it in the emergency room or anywhere else, we don't have to have her sign again.
One less piece of paper for a new patient. I like it.
Okay, let's see. Now we can start to preload her demographic information from VITL Access. And then when she comes in, all we have to do is confirm that that's accurate, and she won't have to fill out a clipboard full of paperwork. Okay. The nurse will also be able to see her current meds right here.
Okay.
And that's either from the summary of care or from VITL Access. Okay. So now reconciling meds is much easier than it used to be.
Well, this looks like it's going to save us a lot of time on chart prep since we don't have to wait for someone to send us new information.
Okay. Not only that, but the summary documents essentially have the same information in the same format, so we can locate specific information immediately. Okay. Oh dear. It looks as if she had a complicated hospital stay. And the plan for her is to follow up with us, her cardiologist, and her primary care.
Sally, my name is Liz. It's nice to meet you.
It's nice to meet you.
And I see that you're here for your post-op appointment, although Dr. Smith didn't do the surgery.
Yes, I had surgery up in Burlington, but I didn't want to drive all the way back up there just for a follow-up appointment. Do you think I should have gone back to the same doctor?
Well, no, I'm sure that the doctor up in Burlington would like to see you again and see how everything turned out, but we have all the information we need to take care of you from here on out.
That's good, because I'm sure my doctor wants to know that my diabetes medicine changed during my stay, and I'm afraid I will not remember everything that's happened here.
No worries. Our office staff has already collected all of your medical information, and we have a new system here that allows us to access medical history and results from healthcare organizations throughout Vermont.
Oh, well, that's good, because I couldn't remember all this, and I think the hospital gave me some papers when I left, but I think I lost them.
Did you sign a consent?
I did sign a consent in the ER.
And since you signed the consent, we have all the relevant medical information that we need, like your lab results and your current medication. So why don't we get started with your vital signs, and then we'll go over your current medications before the doctor comes in to see you. So Sally's ready to see you. I've gone over her chart, and everything seems to be complete. The office staff has downloaded the radiology reports and lab results. I've done the medication reconciliation, so all you have to do is sign off on that. And her PCP ordered a CBC a couple of days ago, and those results are in as well. So we can cancel your CBC order. You don't want to do a repeat CBC, do you?
No, that's not necessary.
especially since we already have recent results from a couple of days ago.
Okay, is there anything else you need before you go in to see her?
No, I'm just gonna look over a report before I go in, and looks like everything's been taken care of.
Great.
So these brief vignettes represent how the Vermont Health Information Exchange can be used to inform healthcare decisions. Over the last 9 years, VITL has been working closely with the state and federal government and healthcare organizations across Vermont and New Hampshire to build this capability. We are now in the process of launching that provider portal, as I mentioned earlier, VITL Access. I'd like to now ask that our actor volunteers come on out, and also ask Dick Hebert, our director, to come on up, and if you would join me in thanking them. Here they come. Give them a second. Some of them just got out of the hospital, as you know. So.